Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. Welcome back.
Hi, Haley.
How are you?
Good.
Good.
Talk.
Good. Glad to hear. I wanted to start the conversation off today and ask you about something that I see affecting quite a few of our patients in our clinic, and that is about their blood pressure. And essentially, what is a healthy average blood pressure and what is a high blood pressure?
Okay, that's an excellent question. It's hardly a day that goes by that I don't have somebody that has this problem. And before I answer your question, let me kind of give you the normal routine when it comes to blood pressure. Normally what happens is people don't know they have high blood pressure because they can't feel it. There's exceptions, but they are in fact exceptions. The rule is people don't feel when their blood pressure is high. So anyways, they come in and we're working on something else, and we take their blood pressure, and as an incidental finding, we find out they have a high blood pressure. Something like, 150 or 160 over 90. That's kind of a typical entry-level high blood pressure. They can go a lot higher than that, but most of the time people be, around the numbers I'm giving you to like when we first find that there's high blood pressure. And in a typical doctor office, what you'll do is they'll say, oh, you have high blood pressure. Usually they'll check it a few times just to make sure it's not kind of a one-off weird thing. But if you show a consistent pattern 3 times of having a blood pressure, above 140 or 150, somewhere around there, you'll get put on a blood pressure medication.
Right.
And this is normal.
Right.
This is what people do. They found the problem and now they have a solution, and that's just how it's done. And it turns out that is actually not the best way to handle the situation. Now, I'm sure there's people that's exactly what you should do, and I don't want to second guess all the other doctors, but today's conversation wants to be about getting to the heart of the problem and fixing it for real. And just by pushing blood pressure down, you're really not getting to the heart of the problem.
So, in finding that heart of the problem, then why do people have high blood pressure?
So the interesting thing is most of the time no one asks. In fact, there's a name for this kind of blood pressure. It's called having essential hypertension.
Okay.
And essentially no one investigates, or it's not obvious what's causing
Essential
the blood pressure.
hypertension, meaning that it's essential to their body to operate?
No, I don't know why they call it essential. It's just the convention of when you can't figure it out, you call it essential.
Oh, okay. That makes
Really,
sense.
honestly.
Sure. Yeah.
So what I've figured out, and other people have too, is that when someone's blood pressure is high, the blood pressure isn't actually the problem. The high blood pressure is the solution. Mm-hmm. It's what your body's doing to solve the real problem. And you're going to say, what's the real problem?
The real problem is being that there isn't enough blood to the extremities in places it needs.
You can see where I'm going with that. That's exactly
I
what
know
it is.
you long enough.
Yeah, so what the real problem is some part of your body, maybe all of your body, but at least some part of your body doesn't have enough blood. Mm-hmm. And so the cells that live there, the parts of you need more blood. And so they call for more blood. They send a signal that you need to send more blood down here, and so the body
increase
responds.
That heart rate, increase that heart pumping.
Yeah. So there's a couple of ways your body can increase your blood flow. Mm-hmm. One is it can increase the blood pressure. Uh-huh. Another one is it can increase the pulse, the rate at which the heart beats, and a lot of times both will go up.
Yeah, do you often see high pulse with high blood pressure?
Mostly.
And vice versa?
Not always. Sometimes we have people with high pulse and not high blood pressure, and vice versa. Most of the time, if somebody doesn't have enough blood flowing through their body, you'll see an increase of pulse and an increase in blood pressure. So, when somebody comes in like that, you don't want to put them on a antihypertensive medication because you're not solving the problem. And when you do that, if a doctor does that, and God bless them, they're doing the best they can to help, and there's reasons for doing this. Let me just say that. I'll come back to this a bit, but what a patient will do is they'll feel tired.
Yeah.
They'll feel wrong. They'll say, I feel better when I don't take my blood pressure medication.
So then why do we even treat high blood pressure in the first place?
Because high blood pressure can lead to increased risk of heart attack and stroke.
Yeah.
The kind of the funny way I say that is that your blood pressure, as it gets higher, the chance of you blowing a gasket goes up.
What are the stroke and heart attack
like
points?
level?
Yeah,
when you're going to get a
levels.
heart? There's no hard and fast rule. It's not like you get to a certain number. It's just the higher it goes, the more likely it is for you to get a heart attack and stroke. That's really what it boils down to. Now, people can get high blood pressure normally, and they don't get a heart attack and stroke. And that's funny. It seems so obvious to me, but a lot of people actually don't know this. Let's say you're out in the yard and you're trying to move a rock. It's in the way. You're trying to roll it over, and you're heaving hard and pushing hard on this rock, right? Or picking up something heavy. And your blood pressure will go up to maybe 250 over 140. Not an unreasonable blood pressure for you to get as you're picking up something heavy, right? So you think, that's so high.
Yeah.
I should be in the emergency room. Man,
Blowing
I
a
die.
gasket.
Yeah, no. If you could do it for short periods of time, it turns out to be safe. Now, admittedly, you could blow a gasket at some point, but the chances are low.
Okay.
Now, if you're a professional athlete, your blood pressure could get as high as 350 over 200
Wow.
and not blow anything up. Weightlifters.
But that's because their body is used to that?
Yep.
Okay.
That's exactly what it is. Because you're used to putting out a maximal, effort, which brings your blood pressure up.
Okay.
I mean, even sprinters or just athletes or even
Endurance
weekend athletes, you're playing baseball and you're running the bases, suddenly your blood pressure is way higher because your body needs more blood. The same thing that we were talking about earlier, which is if your body needs more blood, it says, hey, send more blood, and so your blood pressure goes up and your pulse goes up. If you're running the bases at the company's softball game,
Yeah.
your body's saying, hey, send more blood, and exactly the same thing happens. It's appropriate. It's how your body functions. It's how we're designed to function, is to be able to have a variable output of blood depending on the need for that blood.
So you were talking about patients being prescribed
Antihypertensive.
antihypertensive medication, and them not taking it because it affects them. It makes them fatigued. It makes them feel off. But
So Haley, we get these people in our office,
Right.
Because we do
Absolutely.
alternative medicine, so they line up.
sure, yeah, we see it a lot,
Come
and
in.
I'm not asking.
My other
from-
doctor's putting me on blood pressure medications. Isn't there an herb we can take?
Sure,
That's what
yeah.
they always say. Isn't there an herb we can take? Because I can't take this other stuff. And I say, yes, there is an herb, and the herb will do exactly the same thing that the medication will do.
Are there any risks associated with the herb as opposed to the medication?
You bet.
Yep.
Yeah, it's the same thing. So herbs, the medications a lot of times come from herbs. So the herbs are there to lower your blood pressure through various mechanisms, and so do the medications. I mean, a lot of times the herbs are gentler, and in some ways they're less effective, in some ways they're more effective, depending on how you look at it. And that's another show going into talking about herbs. I'm going to leave the herb thing alone. Let me just say that that's not the way to answer that question, because you're just trading one suppressive agent for another suppressive agent, and that's not what we want to do. What we want to do, the real thing to do, is figure out, why do you need so much blood?
Yeah. Or where is your body lacking blood?
Yeah, what's going on?
Why isn't it processing the blood that you have?
Can you think of a reason why somebody would need more blood?
Infection? They're fighting infection?
Not in this case. That's not usually what it is. The answer is yes, but in that case, people are sick.
Yeah.
And they're not coming in.
So they don't have any other symptoms?
Yeah, so there are no other symptoms.
They aren't processing oxygen.
Well, the oxygen levels could be low. That could be one reason for it to go up. Yeah, you're right. If your oxygen levels are low, your body will respond by making your blood pressure go up and your pulse go up to compensate for that. Now the question is, why is your blood oxygen levels low? Now, I would be careful because we'll go into all of medicine.
Sure.
Let me just say there's a breakdown somewhere. So here's a common one that'll show up. Maybe you got some kind of blockage somewhere.
Yeah.
You know, your artery's got a little plaque that's, got piled up in one little area. Blood's not flowing through there correctly. Something's not working right. And voila, you need more blood. I had a patient that come see me with a blood pressure of 240 over 160.
And they were fine? They were upright and walking?
Yeah, totally fine, walking around, everything
They felt okay? They didn't feel
perfectly fine.
overstimulated at all?
Found it as an incidental finding. They had no symptoms whatsoever. And so I was a young doctor at that point, and I thought, oh my goodness, this patient is going to have a stroke. So I sent her to our local internist, and the internist put her on a medication which didn't work. By the time she came back to me, she had been on 3 medications, and her blood pressure was exactly the same, hadn't changed a bit. And she said, look, Dr. Luper, I did everything you said. I went to go see all these other people, and I'm exactly the same as I was before. And I'm still learning how to be a doctor, and I thought, boy, your body sure is fighting hard to get your blood pressure up. Maybe there's a blockage. And so what I did is I sent her in for an investigation to find the blockage, and sure enough, we found a blockage in one of her arteries. Her artery was like 90% blocked, and so there wasn't enough blood flowing through. We sent her over to the cath lab, and they did one of those little balloon cath things where they expanded the little section, and boo, her blood pressure came down, I don't know, 80 points.
So what is it if they aren't dealing with a blockage?
There's some kind of problem somewhere. It's not always a blockage. It's something. Let's just say something. It may be that they're just more pressure, that they got, too much fat on them, or that they're sitting around too much, and now their blood vessels the blood doesn't move through their blood vessels right. And so literally their bodies are saying, I don't have enough blood, and so their blood pressure will go up in response to the fact that they have a desk job.
So you think that exercise, body movement is a way to reduce blood pressure?
It can be. Okay. Now, if it turns out that the patient we're talking about, the pretend patient we're talking about, is somebody who has had their blood pressure kind of inch up, there's no obvious reason for it to be a block in blood flow. And then the question is, okay, your body is making your blood pressure go high in order to make more blood flow. Is there another way we can supply that blood that your body needs? And if we do that, chances are the call for more blood will go away. And the answer is, yeah. I mean, you could exercise. Let's say you exercise and you went and you did, some kind of treadmill thing or jazzercise thing or something like that, and your blood pressure while you were exercising went to, 180 over 100 or 200 over 110, something like that, for a while.
Yeah, for like 30 minutes,
Yeah,
45
30 minutes, something like that. And now suddenly there's a bunch of blood that's flowing in your body, and your cells are getting, bathed by fresh, lovely blood.
Blood right.
That's carrying oxygen, it's carrying nutrition, it's removing waste products. Suddenly all the things that your cells need it's there.
How long do those effects usually last?
Well, it depends on how long you've been doing it. So the effect will last hours if it's a short amount of exercise. If the amount of exercise is longer, it'll last a day. If the exercise is regular for running 2 weeks, the effect will last several days.
Okay.
Okay? That's a good question. The thing, though, I want to look at is how can we get blood flow to not just increase once, because once isn't going to be enough to solve this problem. We got to get blood flow to increase in general.
Right.
And now your call
time.
for blood's going to go down, and so now you solve the problem. Now there's plenty of blood to go around, right?
But people can't just exercise their days away. They have to work, they have to maintain family and, real life outside of their gym routine or their yoga routine.
So the numbers I just gave you, how long does it last? If you get regular exercise going, it lasts about a day. So then do the math on that one. How often are you going to need to exercise for a half an hour or 40 minutes daily?
4 times a day? Or
No.
4 times a week? Daily.
Daily.
Right, to have the effect, yeah.
Daily. Now, I said if you do it on a regular basis, the effect may last 2 or 3 days. So now that changes the math a little bit. You don't have to do it daily, because if you've been doing it daily, now you've got this general effect. And if you quit doing it for a day or two, it still continues on. You haven't been doing it one day, you've been doing it 7 days, so the effect will last longer. So you could take a day off and be fine. Maybe even 2.
What about a week?
No,
Okay.
it'll go back.
Okay.
Good question.
Yeah.
How long does the effect last? A while.
Okay.
And this is common sense because your body will adapt to how you live. But if your how you live goes back to what you were living before, it just falls right back to what you were doing before, and then you have the same problem you had before.
So what else other than exercise might help?
So let's think about the blood flow thing. What other kinds of things could get in the way of blood flow? Maybe the blood vessels could be more constricty. That is, you jiggle them or you poke them or you do something, some kind of stimulus, and they constrict. And now you got decreased blood flow. And you got decreased blood flow, your cells are going, I need more blood. Brrr, blood pressure goes up. So there are certain diseases that cause your blood vessels to constrict. I could give a bunches of examples. I'm thinking of the one that if you do smoking, it causes your blood vessels to constrict. It's called Berger's disease. But who smokes anymore? I don't even want to talk about that one. Let's talk about...
A lot of people still smoke. It's out there. It hasn't gone away.
Well, they don't show up in my practice, so I never get a chance to talk about Berger's disease and the treatment of it, so I'm going to skip that one.
Okay.
So let's talk about a more common one. Let's talk about migraines.
Oh.
Okay?
Yeah.
Yeah, because migraines there's constriction of blood vessels. The classic migraine is when the blood vessels in your neck constrict in response to muscle tension.
Right.
And eventually your brain doesn't like it anymore. It says, look, I need more blood. It can get bad enough to where your brain doesn't work quite right. And you start getting what's known as an aura. And things are funny and you feel funny and you feel disoriented and you can't see things very well.
Yep.
That's lack of blood flow to your brain. And your brain has the ability to say, hey, send more blood. And so the blood vessels will dilate. So your body responds to that. Now, when that happens, you get this horrendous headache, unfortunately.
Sometimes.
Because blood's pounding through. Not always, but mostly.
Yes.
You'll get a headache in that way. So I don't know if that's the best example for us to use. The body's kind of figuring out its own thing because the brain's so important. Let's use another example that's also common, especially here in Alaska, and that is cold hands.
Yeah, hypothermia.
Yeah, it happens all the time.
Oh, yeah.
So in this one, there's a disease where your hands can get cold, where the blood vessels constrict. It's called Raynaud's disease. And it's an autoimmune disease. It makes your blood vessels more likely to want to constrict. But even just normal people, all of us have this reflex. If we go outside and it's cold, our body wants to save our heat, so it constricts the blood vessels that go to our hands and keeps our blood internally. Okay? Now, if you do this occasionally, there's no problem. There's nothing to fix. No problem at all. But the question was, are there other causes of blood vessel constriction, and there's things you can do about it? The answer is yes, there is. What you can do to treat Raynaud's and to treat blood vessel constriction problems is to dilate those blood vessels.
And warm your body.
Yeah. And so the best way to do that is to kind of think of it as a rusty gate treatment. So things constrict and hold, and they don't let go. And so now you have cold hands, and your blood pressure is too high, and you're not feeling right. And so what you can do is you can get 2 buckets of water, 1 hot water and 1 cold water. And you take your cold hands and you put them in the hot water, but it's too hot, so you take them out of the hot water. The temperature of the water is around 125, maybe 130 degrees. A little warm for comfort, for sure. Hotter than a hot tub. So you put them in there, and then, whoop, they're too hot. So then you put them in the ice cold water with little bits of ice floating around. And that's really cold. And so you take them back out again, and then you put them back in the hot, and you go alternating back and forth. So when you go into the hot and you put them up, your hands are red because the blood vessels have dilated.
Sure.
And that's why they're red. You put them in hot, they come up red. Dilation. And when you put them in the cold, they constrict. You pull them out, now they're white.
Okay.
Because you can't see the blood because the blood vessels are constricted.
Right.
So dilation, constriction, dilation, constriction. You run this back and forth 20 times or 30 times, it's like working that rusty gate. Pretty soon it starts moving pretty easy, and now your hands are experts at dilating and constricting and dilating, constricting, and the whole thing works better. But the trick, because we want to come out warm, we want to finish warm. So you think the best way to finish
Middle of the
warm
road.
is to put your hands into the warm and bring them up, and they'll be warm. It doesn't work that way. Because the body has a reflex that whatever you're doing, it wants to correct it by doing the other thing. You go into warm, and it wants to constrict, because it did every other time.
Yeah.
The better thing to do is to put them in the cold. Last time you're doing this, bring them out. Now, every other time it went into the warm and it dilated, so you bring them out and they dilate. And now you have warm hands by coming out of the cold. It goes against common sense, but it turns out to work with the body's internal logic, this homeostasis we talk about occasionally, where if you go too high, your body brings it down. You go too low, your body brings it up. So this homeostasis thing is exactly in play when we talk about blood pressure. The best way to lower your blood pressure is to raise it up. Think about it. Here's your blood pressure. Now, if we push it down with drugs, there's a pressure to want to go back up because your body needs more blood. You let the drugs go off and it runs back up, and some. Or it works its way back up in spite of the medication.
Yeah.
So now you go back to the doctor, it's like, well, your blood pressure is not that good. We're going to lay on another medication and force it down. Now we're going to put in a diuretic and force it down. And eventually you're dopey and you're tired. And they said, doctors, don't worry about it. You'll get used to it. And you do. A month or two into it, you're used to this new inferior version of yourself.
Yeah.
Now, a better way to do this.
Living a
is
half-life.
Your blood pressure's, it's running too high, right? You want it down here. It's running too high. What you do is you push it up.
Yes.
So
you increase it higher than
Yes.
that high rate.
Yes.
Aren't you at risk for stroke and heart attack at that
No,
point?
because you're exercising. Remember we told you that. Your blood pressure can go up to 250 and you're fine, or 350 if you're an athlete, right?
Yep.
No, you push it up, let it run there for a
Regularly.
while, and then let it go, and it comes back down.
Okay.
So this is where it was.
So you're just
the best way to bring it
wiggling
down
that
is not to
rusty
push it
gate.
down. It's to push it up and let it fall.
Yes.
I want to say that again. This is super important. The best way to get your blood pressure down is to push it up and let it fall. This is homeostasis work. This is how our body works. And you will correct the problem. And it's like, I don't have to take anything. Not like that. You actually feel better for it. You come out of it feeling like, I don't know.
You have a sense of vigor.
I feel like things are working. The blood's flowing through me. I feel like I like this. Well, let's do something. Whereas before, you just want to go sit on the couch and watch TV. Bingo.
So
That's how to do it.
We did talk a little bit about herbs that you can use. Can you implement any diet changes?
Yeah, so this is an excellent question, Haley. Excellent question. Because everything I've said is an oversimplification. How could it not be? There's not enough words in the universe for me to say
There's
everything
not
that's
enough
going.
time on the podcast.
So I'm skipping some pieces, and this is exactly one of them. Insulin, which is the hormone your body uses to bring your blood sugars down, when the insulin goes up, so does your blood pressure. So if
Because
your
it
insulin
needs to
runs,
move that insulin somewhere.
so what we need to do is not let the insulin go up. So if the insulin doesn't go up, then your blood pressure doesn't go up. There's a connection. Insulin, one of the side effects it has is make your blood pressure go up. One of the other side effects it has is makes you put on weight. Right around the middle. That apple shape,
Yeah.
that's an insulin effect. Insulin's job is to take sugar, as far as it's concerned, extra sugar, because it's more than you need, and scrape it and pack it away as fat, saving it for a rainy day. And what a fabulous system. What a great
Yeah.
idea. We
Thanks,
got
buddy.
too much now, let's save it for later.
Good idea.
Except for later, what later? Right? Because later never comes, because there's always plenty of sugar.
There's always sugar
And so you
every
get
day.
fatter and fatter and fatter, and you gradually gain weight, and the insulin goes up, and then you gain weight, and you think it's because I'm fat. Yeah, to some extent. There's some physics in terms of the number of pipes and resistance and all that, but a major part of that equation of I have more weight and now my blood pressure's gone up is the hormone effect of insulin itself. So if you get the insulin levels to come down, your blood pressure will come down. Now, how do you get insulin levels to come down? You don't let your blood sugars go up to begin with.
Yeah, you keep a regulated diet
Yeah, regulated in the sense that
of a pattern. You're eating specific times of the day. Your body knows that it's going to get its nutrients at this time, at this time, at this time, and then it's, sleeping and processing. So you're staying
and particularly the
consistent.
nutrients in this case are slow. Mm-hmm. So when you eat them, they slowly release sugar,
Yeah,
and so
like
you
complex
slowly.
carbs.
So when you look at the curve, instead of going like this, right? That's what you should do. If you're eating fast carbs, it goes like this.
Yeah.
It shoots off the page. Then your body releases tons of insulin, and it drops it down, not back to where it was, but below. You get this spike and drop, and that's a classic insulin pattern, excessive insulin pattern, and your blood pressure will go up. Now, I think it's really interesting that there's all these mechanisms.
It's crazy that everything is so intertwined.
Yeah, it is, isn't it? It's interesting. You touch this, and this goes cattywampus. You touch that, and that goes cattywampus. And then there's another piece. If I just gave you a minute, you'd ask this question. I know you would, but I'm sorry, I get excited. There's another piece that we're ignoring here, which I'm not going to ignore anymore, which is stress hormones.
That's what I was going to ask because you talked about the midsection weight. And so is that the cortisol or the catecholamines that is being released because of the insulin production?
Yeah, that's exactly what it is.
Body sends insulin, and then body also sends catecholamines and cortisol.
Yep. And so what ends up doing is the catecholamines in particular raise your blood pressure up. And it makes sense because catecholamines are your get up and go hormones. They're
Yes.
hormones and neurotransmitters both, right? So there's some cortisol is a hormone. Catecholamines are neurotransmitters mostly, but too many words. What they do is they get you ready for action. Mm-hmm. Now, if you're going to get ready for action, there's some things you're going to have to do. One is you need more sugar in your system.
You need a reserve, and that's what the insulin does.
So the hormone we're talking about in this case is cortisol.
Mm-hmm.
When cortisol comes out when you're ready for action, particularly if there's some kind of something at stake.
A bear in the room.
Yeah, a bear in the room. There's the classic example. But you could just be stepping up the bat, trying to hit a home run for your company team. For the office, right? That'll do it just fine as in and of itself, right? Anyways, cortisol is released, your blood sugars come up, your blood pressure comes up, your alertness comes up. There's a bunch of changes in your body to get you ready for action. Your blood thickens up a little bit, actually, so that it'll clot if you get injured, you don't bleed out. There's some details to this, but really, you are prepared for action is what happens.
Absolutely.
And so your blood pressure goes up on its own. Now, if you're doing this every day because you're living in fear, now we don't usually call it fear. We call it anxiety. We call it worry. We call it apprehension.
But the root of it is fear. And your body doesn't know the difference.
Nope.
Your consciousness does, but
and you become accustomed to living in this state of hyper
fight or flight.
Yeah. And so now you have a hard time sleeping, and your brain's not working quite right because you're kind of dopey from all the stress hormones, and your blood pressures come up there as well. So if somebody comes into our office like that, we treat them a little bit differently. We try to help them, and again, that's a whole nother show. We try to help them get their stress hormones balanced, and it's doable.
Yeah.
I mean, I'm thinking of 2 people I saw today who were doing better by fixing this. It's interesting. One of them is now dreaming. Because when your stress hormones go real high, you stop dreaming. I don't know if you knew that.
I didn't, because all of my dreams are very stressful dreams.
Oh. Well, at least your autonomic nervous system is working because it's allowing you to dream. If it's really cranked hard, you won't dream. Everybody does dream, but you won't remember them. Uh-huh. So if you have a balance to your autonomic nervous system, which is your automatic nervous system, it's got a sympathetic side that gives you fight or flight, and a parasympathetic side, it's rest and digest. And if they're in balance, you will remember your dreams. If the sympathetic side is high, which is living a life of fear, right? Are they going to fire me or not? That kind of thing.
Yeah.
And then, boop, you don't remember your dreams.
Huh.
So I had a patient who said, I don't remember ever remembering my dreams, and now I'm remembering my dreams every night. It's amazing. What did you do?
Well, yeah, that's amazing. Dr. Luper, we have about 2 minutes left. Any closing thoughts?
Yeah, I do have a closing thought. The closing thought is, when you find a symptom in your body, it's really, really important for you to pay attention to that symptom and then try to figure out why it's there. Most of the time when people have symptoms, not all the time, there's exceptions to this, but frequently, it turns out your body's trying to fix something. A classic example is you get a fever, your body's trying to fix the infection. So what we want to do is we want to shut down the fever, because as far as we know, the fever's the problem. No, it isn't. The fever is the solution. You want to figure out what the actual infection is and treat that. Blood pressure is the same way. You think the high blood pressure is the problem. No, it's not. The blood pressure is the solution. You want to figure out what's going on underneath that, fix that, and the blood pressure will come down on its own. I'm not kidding you. This is actually a real life thing you can do. This is absolutely doable. Now, you do want to work with your doctor on this. There are situations where people who have high blood pressure can die from it. You don't want to go willy-nilly and try random stuff. You
Get
want
off
to
all
work
your
with
meds and...
Yeah, we don't want to work with somebody who knows what they're doing. But now you know more about why your blood pressure is going up. You can start thinking of stuff. You bring those questions to your doctor, and you know what you get? A better doctor.
Yeah.
That's
train
what
your
I want.
doctor.
That's what I want to end on right there. You're going to get more out of your doctor by asking questions.
Absolutely.
Okay.
Thank you.
Hey, my pleasure.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.